Okay, good evening, everyone. Thank you for sticking around. My name is Jessica Weber. I'm a senior in the Sargent College of Health and Rehabilitation Sciences, and today I'll be presenting on my project titled Evaluation of Boston's Community Fridges as a Food Security Effort. And I have been so honored to work under Dr. Shelley DiBiase, who's the Director of Nutrition. So this is just a quick outline that I'm going to skip to save time. So according to the United States Department of Agriculture's most recent Household Food Security Report, over 38 million people, or 1 in 6 people in the United States, have experienced food insecurity. But what exactly is food insecurity? So the USDA defines food insecurity as the household-level economic and social condition of limited or uncertain access to adequate food. Symptoms of living in a state of food insecurity are disrupted eating patterns, reduced food intake, or reduced variety, quality, or desirability of diet. Food security, on the other hand, is therefore the absence of these issues. So high food security would therefore be households had no issues or anxieties about consistently accessing adequate food. So I'm sure, as many of you are aware, Massachusetts is one of the most expensive states in the country to live in, with Boston being even more expensive. Eastern Massachusetts boasts the highest food costs in the entire state, with an average meal costing $3.84, and an individual in Boston can spend upwards of $434 on groceries alone each year, so you can eat each month. So you can see how that already presents a financial barrier. And although food insecurity was an issue pre-pandemic, you can see 8.2% of households experiencing food insecurity, COVID-19 has had detrimental effects on the rates of food insecurity due to mass unemployment and faltering emergency food systems. The peak of Massachusetts food insecurity was in May of 2020, but you can see here that even in March 2022, we have not recovered to anywhere near pre-pandemic levels. So why exactly is this an issue? So beyond the immediate physiological effects of hunger, poor nutrition due to food insecurity in a cycle with chronic physical and mental health issues can lead to metabolic, immune, and developmental problems, as well as increased healthcare costs and a decreased quality of life. And although there are many programs and initiatives aiming to reduce and prevent food insecurity in our communities, there are still a lot of gaps in reducing food insecurity in Boston. So these gaps have become even more apparent during COVID-19, which is why community members began establishing community fridges across the country. So a community fridge is an outdoor fridge that's often accompanied by a pantry. It's located in public space or on a sidewalk, or it's next to or in front of a partnering business or organization. And fridges are maintained by groups of volunteers and receive donations of goods such as produce, prepared meals, and even hygienic items and spices that anyone passing by can take for free. So due to their newness and limited capacity of volunteers to consistently collect community feedback and data, I wanted to generate 2 relatively broad research questions to guide a pilot study in which future research could be based. And so what I really wanted to know was who these fridges are serving, so what is the makeup of these people, and also why do people visit community fridges as opposed to other places or in addition to other places where you can get food. So to answer these questions, we used a mix of nutrition and public health methods. And last summer, we developed a 23-question survey to guide quick interviews with people who visited the fridge. And because there are so many community fridges all around Boston, you can see that on the top map. We chose 4 locations, which are those 4 fridges right there. And the areas they serve are in those yellow boxes right there on the lower map to represent Boston's community fridges as a whole. And so all 4 of these locations were located in close proximity to higher educational institutions such as BU, MIT, and Harvard. And they're also in areas very prone to gentrification due to influx of wealthy, usually white, young individuals. And so this allowed for comparison of responses by different fridge location while still tying them in with a common theme with their proximity. So the survey itself had 3 main parts. We had closed-ended questions about demographics such as age, zip code of residency, and highest education attained. We also had open-ended questions, such as what aspects of the fridge do you most like? What do you feel can be improved? And we also included a 6-item short form of the 18-question U.S. Household Food Security Survey module to determine respondents' food security status and rank it as either high, marginal, low, or very low. And so we analyzed, So we went, with the assistance of 4 other BU students, we went to each fridge at least for 2 hours each week from October to April, and we approached every person who approached the community fridge and asked them to partake in this quick 5-minute survey. And when they were done, when they completed the survey, they were compensated with a $5 gift card to a healthy, affordable grocery store located near the fridge. And because we had a very small sample size in February, we also posted signs advertising the study, and we conducted a few interviews over the phone. So we analyzed the responses to closed-ended questions with descriptive statistics, and we obtained information on demographics, food security levels, food sharing practices, and more. And we also were able to identify emergent themes or common statements or opinions that the respondents gave through the responses to the open-ended questions. So despite having a relatively small sample size of 10, which is about 40 less than I had hoped for, we did have a relatively diverse group of survey participants with 5 zip codes represented. And the respondents reported various races, educational attainments, and places of birth, such as Texas, Singapore, Boston, and Haiti. So the average age group that the respondents fell into was over 65, and there was no one under 35, which I thought was interesting. The majority of people were renting at 70%, with 60% of those people stating that they lived in some sort of a roommate or a housemate situation. And then 60% of respondents reported unemployment or inability to work, and many reported relying on their pension or Social Security. So in terms of food security status, about half of respondents reported low or very low food security, and then the other half reported high or marginal. And in addition to community fridges, respondents most commonly reported depending on grocery stores to obtain their food, as well as other places such as local farmers markets, nonprofits, or religious organizations. And about 2/3 of survey respondents were enrolled in SNAP, or the Supplemental Nutrition Assistance Program run through the government, at 66.7%. And the average number of times that respondents visited community fridges per week was about 1 to 2. And furthermore, 30% reported that they provide food for someone that they're living with, and 20% reported that they're providing food for someone outside their home. So that could either be people in their apartment building, family members that live somewhere else, or there were a bunch of other options too. So we were also able to identify some common themes from responses to the open-ended questions. So participants frequently described convenience and the need to supplement grocery store purchases as motivations for going to the community fridge. And they also commonly reported that food availability was inconsistent and insufficient, sometimes with days going by where the fridge or pantry was empty, or they said that nothing was worth taking. But nevertheless, they did report that good food is frequently available, although when it's added is inconsistent, and a lot of participants cited pre-made meals, fresh produce, and meat as quote-unquote good food. And they also expressed an appreciation for the variety of food that is available, including the possibility of being pleasantly surprised when you are trying a new food, or just trying a new food that you have never tried before. And then additionally, we asked participants to indicate what aspects of the community fridge they most liked, and about 30% of all respondents said that they liked most that the food was free, which makes sense. So in conclusion, we found, just based on this very small sample size, that people visiting community fridges for food vary a lot in their backgrounds, food security statuses, and food preferences, as you might expect individuals to. And they mostly identified positive aspects of physical proximity and accessibility, as well as general convenience, as well as the variety of food available when the quantity is consistent, because otherwise they complained of inconsistent and insufficient food. Or, for example, one respondent had cited that one time the fridge was completely full of stale bread. So, for example, like that would be a bad aspect of going to the community fridge. And moving forward, there are a lot of different trajectories that research about community fridges could take, but I would like to really focus on analyzing the nutritional quality of the food available in the fridges and pantries, as I already have 4 months worth of data from the Discord channel that the Austin Brighton fridge volunteers use to send pictures of the fridge contents. And so I want to analyze that, and that could maybe be used to further determine community nutritional needs and tailor donations. Oh yes, and I have to thank Europe and Kilachand for financially supporting me, and that I was able to pay my research assistants, which was amazing. My sources, and thank you so much.
Fantastic work. I'll start with one question.
Mm-hmm.
So do you view ultimately community fridges as a good solution or the ideal solution to food insecurity, or would you suggest other kinds of interventions?
I think that any intervention that relies on people with like a higher economic status donating, and the people that are getting the food are reliant on donations of other people, as I don't think it's sustainable or truly like food justice in its truest term. But I think for the interim, I think that there is a need to get like especially fresh fruit and vegetables to communities that sometimes don't have access to it at all. Like they might just have like a bodega or a convenience store as their main source of food. So in some aspects, it is good. In some aspects, it can be improved.
Really great project. This might be outside the realm, so if it is, feel free to just say so. But in terms of if this could be applied to like non-urban areas, like rural or suburban areas, do you think that food fridges in places that are still food insecure but aren't as urban would be a success or be a solution to the degree that you were seeing in Boston?
To be honest, I'm not sure. I was thinking about, there is a community fridge in Newton, which is a relatively affluent area, which I was kind of shocked to see at first. And I'm not sure like how it has gone or how beneficial it has been to the population. But I don't know, like I feel like if on a community level that they felt food sharing would be beneficial, then maybe, but I'm not sure.
Really good work. I really enjoy listening to your project and how passionate you are about it. I've seen that you're engaged very frequently with this project at a personal level, so thank you for doing this. And my question is essentially, you mentioned that limitation with having it be a donation-based and a community-based program. Is there a chance or even a speculation that you could partner with, what am I trying to say?
Like restaurants or like grocery stores?
Well, not necessarily just businesses, but local governments, is what I'm trying to say. That you could partner with local governments to further sustain, at least at the minimal level, a source of food for those fridges.
Yeah, that's a very interesting question. So I'm not sure how familiar you all are with mutual aid, but the concept is very like leftist based, and many of the people that help to maintain the community fridges are very opposed to partnering with politicians or government. So I don't know. I think it depends on like how the individual community fridge is maintained and who is running it. I think there definitely needs to be more consistency, so where that would come from, I'm not sure, but maybe.
Another question?
Great presentation. I was just wondering, you noticed that with the people that you sampled, that most of them were of the older population. Do you think like that would stay the same if you had a larger sample size, and if so, why?
So I don't really know. I was honestly very surprised that nearly everyone was over 65. I'm wondering if it's because of the time of day that we went to the fridges. So it was mostly during the day on weekdays because we were all undergraduate students, so we had to go like in between our classes and work schedules. So I'm sure that many people were at work. So I don't know. I think that it will probably be different. And also if we, just from my experience going to other community fridges in Boston, there have been much younger like populations there. So I feel like it would be different, but maybe it would be reflective of that a lot more of the older populations using it too.